Thank you for joining us today for our webinar, Building Recovery Friendly Communities. I'm going to give it just a minute and let people hop on, and then I'll get started. We're going to go ahead and get started. Today, our webinar is Building Recovery Friendly Communities. And Stephanie Robinson is going to be sharing with us today. She's going to tell us a little bit about herself before she presents and share a little bit about the work she's doing. And then she has a great presentation for us today on building recovery friendly communities, which I'm really looking forward to listening to. So just to give you a little overview of relink.org, we are a web-based free resource. We have all different kinds of resources that are listed in our database. We have everything from recovery services, which we're going to be talking about today. We have human trafficking, advocacy and help. We have basic needs. We also have things for people who are reentering into society, whether it be from incarceration, from homelessness, from addiction. So we have all different resources that are listed. We have over 16,000 resources listed in Relink, and we are free to use and free to be listed on. When you go to relink.org, this is the first page that comes up, and you can click on Find Help Now. And when you do that, you can enter a location. So you can search by city, zip code, the county, and you can do different ranges of miles. So you can do within 10 miles, 25 miles, 100 miles, and then you'll select your category of care. So for today, I have addiction recovery highlighted because that's what we're going to be talking about. But like I said, we do have those other categories of care that are also listed in relink.org and resources in each of those. When you do click on addiction recovery, these are the options that'll come up. So we have treatment, housing, peer and other support services, harm reduction, and prevention services. So we have all different resources listed in all 88 counties throughout the state of Ohio in those different areas. You can be a provider on Relink. We try to make sure that every resource in the state of Ohio is listed. So if anyone is in need and they go to our database, that any providers are showing up there. So if you are a provider who isn't currently on Relink, it's really easy to get on Relink. You can just make a page that connects to your login, and then you have access to edit that at any time. So if you need to edit hours or times that you're open or information, contact information for anyone, you can easily do that. Your address, any services that you offer that might have changed, you can easily edit those as well. So you just go down and you click on add resources on that same homepage when you go to relink.org. And when you click register to create, it creates a new account, and then you can sign into that account. And then we'll, on our back end, we see that you have created that page, and then we're happy to connect you to your page for editing. One thing too that we're really pushing this year is if you do have any bed capacity and you have a number of beds that are open per week, you can go in and easily access that information and edit it the same way that I just said. When you go in and do that sign in, that login, you can put how many beds that your facility has available. It really draws the attention of anyone who's in need and who's looking, because then next to your provider information, you'll have a little green bed, and that'll mean that you have beds that are open, so people know that they can call and that your facility is able to take them. There will be one social work CEU that will be awarded for participating in today's webinar, and usually I get those CEUs out the week after, so you should see those next week. A survey will pop up at the end of this webinar. Hopefully, sometimes it works and sometimes it doesn't, but I do always send that same survey link in the follow-up email that I send the day after the web. If you need to click on it and access the survey through that, it's just 10 simple questions, but one of them on there does ask if you do need a CEU, so I'll be happy to get those to you. And this is all of our contact information at relink.org. So if you want to contact us, you can call us at the phone number listed there, or you can email us. We're always happy to help you get your data on Relink, edit your data, or if you're looking for a specific resource or you're having an issue finding something, you can always call us and we're happy to help. So I am now going to stop sharing and let Stephanie share, and she's gonna share her presentation with us today.
Okay, can you see that?
Yes.
And you can hear me?
Mhm.
Okay, great. Thank you so much, Rachel. My name is Stephanie Robinson, and I am here today to talk about building recovery-friendly communities. And it's my absolute favorite topic to talk about because I truly believe that an investment in recovery is a investment in community. And just a little bit about me. I am a person in long-term recovery. So for me, that means that I haven't used drugs, alcohol, or engaged in eating disorder behaviors for over 16 years. And this is my little family. This is Piper. She's 8. Jacob is 13. John is 13 years in recovery himself, my husband, and he wouldn't mind me sharing that. This slide has become like a contest in our house, like who can catch the biggest fish. And the real stars of the show are on the end. That's Bogey and Bruno, our 2 field spaniels that we have. I am the founding executive director at Hope Recovery Community. So I started the recovery community organization about 6 years ago. I also do special work and consulting for the Opioid Response Network, the National Peer Recovery Alliance, and OCAR. I love all things recovery. I love peer support. I love community-based, like grassroots work in the community. I just think it's so valuable. And so when we're talking about building recovery-friendly communities, we're really talking about recovery-oriented systems of care. How do we make our communities where we live recovery friendly for a person to be able to access recovery, for a person to be able to get support and resources, and for them to be able to live in long-term sustainable recovery as they define it. Oftentimes, we want to have like silos solving the current addiction crisis that we have. Oh, we need more treatment. We need more recovery housing. We need more meetings. We need multiple pathways. We do. We need all of those things, but individually, those don't create recovery-friendly communities. Recovery-friendly communities need all of those things, and they need to be connected and working together. And when we talk about recovery, we have to understand what recovery is and what recovery isn't. And really, that starts off with the conversation around addiction or substance use disorders. And we need to understand and come from this point that addiction is not a choice or a moral flaw. I'm not a bad person who was making bad decisions. I was a sick person who has a treatable disease. So addiction is an illness. And I would think by now that we could all agree upon this, but that's just not the case. Often we come through this lens of moral failing, and we need to come through this disease model lens. When we're working in substance use disorders, in addiction, and in recovery, we need to understand that this is a disease and should be treated like any other disease. Right? And that about 40 million Americans are impacted by addiction, and probably more. That's probably underreported. And this isn't new news. This isn't breaking news. It's been nearly 70 years since the science and medical communities have defined addiction as a chronic brain disease. Still today, often people look through the lens of this moral failing. Often society looks through this narrative of what and these are stigmatizing words, but drug addict and alcoholic, right? what they look like, what they act like, the judgment and the biases that we have against them. And we have to get really honest to make sure that we're coming from a place of this disease lens, because that changes how we speak about that person. It changes how we treat that person, and ultimately it could change that person's outcome. So we must understand that addiction is a disease. Um, the disease is a substance use disorder. And again, about 23 million Americans need treatment for substance use disorders, and only 10% receive the treatment they need. On contrast, 85% of people have, of the 29 million people that have diabetes, are getting treatment. Diabetes is also a disease that's often stigmatized. Um, Stigmatized means that there's a negative label associated with that. And people are blamed, right? Blamed because they have a substance use disorder, maybe blamed because they have diabetes. But as you can see, substance use disorders, only 10% of the people that have the disease that need treatment are getting it, right? What other medical condition in the United States would we be okay with only 10% of people getting treatment? Right. And so we need to really be aware of the stigma associated with substance use disorders, and alcohol use disorder is even more. So 32.6 million people are affected by alcohol use disorders, and only about 7% or almost 8% of people seek treatment. Right. So it begs to question, like, why? Why do you have this large amount of people that have this disease that are only a small percentage getting the treatment? Right. And we need to understand that oftentimes it's around stigma. It's around this perceived assumption that people that struggle with substance use disorders are weak. They lack will, they lack motivation, they lack empowerment. And that's not accurate. The majority of people I know in recovery and people in active addiction are some of the strongest willed people I've ever met. They're some of the most resourceful, best communicators, hardest working individuals I've met. Right. So we have to understand it's not the disease that is the issue. Um, it's the disease that's the issue, right? It's not the people who have the disease. And honestly, I don't really think it's the people or the disease. It's often the system. It's often the narrative in this society and the culture that we've created, right? When you watch TV or you see a substance use disorder, put out in the news, or it's in a movie, it's often just portrayed in a certain way, right? It's stereotyped, it has a certain look, it has a certain feel. And right, for me, when I was in active addiction, I didn't meet that criteria. So I thought I must not have a problem. And then I saw the way people judged and the assumptions they made about people who had alcohol use disorder or had some form of substance use disorder. And I didn't want them to think about me like that. And so we've created this system that perpetuates illness and makes it hard for people to get help. And that's what creating recovery friendly communities is all about. It's about challenging this narrative, and it's about adjusting and correcting and editing the system that we live in, our communities, because we want our communities that people that have diseases are able to access care for those diseases. And it shouldn't just be some diseases, it should be all of them. We don't get to pick and choose who deserves or doesn't deserve treatment of any disease, right? And so we need to create communities where people can get that help, and that people can access care, access housing, access jobs, education, all the things in a recovery friendly type of way. Currently, many of our communities are just not recovery friendly. A lot of communities in general, you can't go anywhere after 9 o'clock that maybe doesn't serve alcohol, right? It's hard to find recreational activities for adults. It's hard to find maybe a mom's group that doesn't, drink. And so can be really hard things. So we need to take a look at our communities, right? And again, we need to look at why 90% of people with substance use disorders are not receiving treatment. Why is that happening? Like, that is absurd. And that research continues to hold true. Um, so why don't people get the help they need? Well, often it's stigma. So they don't want to be labeled, right? I had a guy call me once, and he said, I said, "Hey, it's Stephanie. This is Stephanie with Hope Recovery Community." He said, "Stephanie, I'm not an alcoholic." I said, "All right." And he said, "My name is," and he told me his name. And then he proceeded to tell me every symptom of a extreme alcohol use disorder, or in stigmatizing terms of an alcoholic, right? He just didn't want to have that label. He didn't want to have that judgment. He didn't want to be discriminated against, stereotyped, isolated, judged, humiliated, talked down to. He didn't want any of that. And so I said to him, "Would you be interested in exploring your relationship with alcohol?" He's like, "Yes, I'm interested in that, but I'm not interested in any of that alcoholic stuff." Right. And so he didn't want that label because with substance use disorders, we call people by the disease. Can you imagine if a person was diagnosed with cancer and we called them a cancer? We would never do that. But yet, with substance use disorders, we call people by the name of their disease, which is incredibly stigmatizing. And it makes it hard to get help because people believe that about themselves. Every Monday when I would return to use, even though I said I was going to stop drinking and stop doing drugs, I never thought to myself, "Oh, this disease has the best of me." I thought, "Stephanie, you're not strong enough. You lack the willpower. You're not disciplined enough. You're lazy, right? You should be ashamed of yourself. You're worthless." And then I would use more because I had to combat those feelings, right? People often also don't seek help because of a lack of resources. Right now in the state of Ohio Recovery Housing came out with a report that we're only, placing like 30% of people into beds that are seeking recovery housing. Certain types of resources we lack in certain areas. So some areas are really heavy and saturated with treatment. Some areas lack recovery housing or diversified recovery housing, right? We have this real problem with a gap in resources. And that makes it hard because substance use disorders it's difficult, and we need the resources along the continuum of care. We can't just go to treatment. We can't just jump into recovery housing, right? We need this whole buffet and menu of offering along the continuum um, of the substance use disorder and the continuum of recovery. People really struggle to navigate the system because there's real and there's perceived barriers. Oftentimes people will tell me, "I can't go to detox because I can't wait for 2 weeks." And I'm like, "Who's waiting 2 weeks for a detox bed? Like, that's not real." But then there are real barriers. There's barriers to quality care. There's barriers to insurance. There could be transportation barriers. Again, there's somebody who calls and says, "I have kids. I don't have childcare. I have dogs. I have Medicare. I have an open wound. I don't have a driver's license. I'm from another state. I have warrants." There's all these things that are happening all the time. And we're able to navigate those, but usually a person, if they don't luck out and find somebody to help them navigate that, the system is just too hard. It's hard enough to ask for help. And we believe, and I believe, that seeking help shouldn't be harmful. I mean, think about that. Seeking help shouldn't be harmful. It shouldn't be trauma inducing to get your substance use disorder and or mental health addressed. And people, they Google, they make 50 phone calls, nobody calls them back. People treat them like crap. They judge them, and it's really difficult because the system is very hard to navigate. Sometimes people they're in denial. Maybe they don't think they have a problem, right? Ultimately, when it comes down to it, it's really because at the core of the system, our communities are not recovery friendly currently. So we live in communities. I lived in a community in Medina, middle to upper class, super conservative, and like people like me didn't have problems with drugs and alcohol. And here I was, I had a problem with the drugs and alcohol, and I didn't look like it looked on the poster that sat in the back of my health class, right? I didn't have this image that I see in the movies. I didn't have any of that, and I didn't want people to think that there was something wrong with me. So it was hard for me to access help. Stigma is one of the biggest barriers to treatment and recovery for substance use disorders today. And often the language we use contributes to stigma. In the field, in the addiction field, in the behavioral health field, the amount of stigmatizing language we use is insane. We shouldn't be calling people drug addicts and alcoholics. We shouldn't be referencing people and, bodily fluids as clean and dirty, right? We shouldn't be using slang terms. We really should be using medical language when we're talking about a disease here. And so that language, it impacts people massively, right? And oftentimes I come home and I tell my husband, why didn't we pick something else? Like, why didn't we pick to, like, save the rainforest or work with turtles or dolphins or something, right? The nonprofit world is really hard, and we were really called to this space. But illicit drug use disorder is the most stigmatized health condition in the world, right? And alcohol use is like not far behind it. So you have to realize that the work that we're doing, if you're in this space working, if you want to create a recovery friendly community, it's all an uphill climb. It's really hard, because we work with so much stigma. So everything we do is kind of having to overcome just to get to even ground. Right. So it's important that we start this work. It's important that we create communities that are recovery friendly, that if I so choose to, I can be open about my recovery. I don't have to be, but that I can navigate my community and get jobs, right? And connect in community, and have housing and have basic needs and have a family, however I define that, right? That is recovery friendly or recovery oriented. Right. Right now, though, we're really struggling in this space often where we have this moral failing versus the disease model. Oftentimes, we see this moral failing lens, and we do a lot of advocacy around this to shift this, right? To have people like, I worked in the behavioral health space, and one day the psychiatrist emailed me and said, Stephanie, John Doe is such a liar, right? Because John Doe had just started MAT or MAR, medically assisted treatment, medically assisted recovery. And he wasn't perfect that first week. And I said emailed back, I said, I think you mean that John Doe is displaying symptoms of a substance use disorder and having the normal challenges with medically assisted treatment, right? And she didn't really like that. But how she would treat John Doe the liar versus John Doe the patient with symptoms was going to be very different. So we need to understand that. We need to have the right lens, and we need to get honest with ourselves if we need that lens adjusted, right? And it is hard. Some people that I know that have worked in the field the longest, right? They struggle with this still, right? We have this overuse of stigmatizing language, whether it's the words we say or our website or this glamorization of the horror, right, of active addiction, right? It's just we don't need to create more drama. We don't need to create, right? Recovery is also super beautiful and super magical, but we don't really focus on that. We really look at all this dark space, and it makes people believe that it's a very hopeless place to be. But there isn't. There is hope and there is treatment. But we do have a lack of quality long-term treatment, right? When you talk about clinical services, oftentimes people feel like, oh, well, wait, like I should be able to turn around my life in 30 days, right? You're like, no, like it's generally not that simple. But treatment options are generally short, but we know that the brain dynamics and the healing process takes longer than those 30 days. So oftentimes a person might go to treatment, and then if they come back to their community and it's not recovery friendly and it's not recovery rich in resources and recovery capital, that person is going to really struggle, because we have a lack of recovery support services, which is our non-clinical. So we have a lack of quality long-term clinical services, and we have a lack of recovery support services. And often, while there are some barriers with treatment, with outpatient treatment, assessment times can be long. There's wait times for peer support. I remember in the behavioral health space when somebody's like, oh, it takes us like 3 weeks to connect somebody to MAT. I was like, wait, what? That's not right. Like, these systems weren't really built for us. And so we need to, from the outside in and the inside out, start to modify this and make sure that our communities are recovery friendly. So a person can come home from treatment, and that treatment centers are spending just as much on aftercare as they do marketing and outreach, right? We've got to have people prepared to return back into home after inpatient, or what does that recovery housing process look like? Right. We struggle because we have system navigation issues. Every day we get two options in this space. We're either helping or harming. We're either barriers or we're bridges. We're getting in the way or we're connecting people to wellness and recovery. I find often that we are harming people and creating additional barriers. There's enough barriers. It's hard enough, right? And we just have to do better. We have to do better because we know a lot of people are dying, right? The overdose numbers are coming down ever so slightly, but and I love to be happy about that, but I hate to celebrate preventable deaths. Each one of those is preventable. Right. And let's not forget that more than 140,000 people die with alcohol related use in the US each year. That's probably a low number because it's not always connected to alcohol within the reporting system. Right. We talk often about overdose, but let's be really honest here. We have an addiction crisis. And we have to acknowledge that, especially because it can be hard in our communities if we only acknowledge certain substances. We have to be aware that some people, that alcohol is their trigger. And how do you live in a society that seems to be really connected with alcohol as a social norm in our culture? And that can be really difficult. So we need to understand that SUD recovery is not just possible, it's probable, right? We always talk about, oh, it's possible. And it needs to be the expectation, not the exception. Right? We need to get more comfortable with expecting that this should be the outcome. Not, I'm grateful, but like, oh, good, 1 out of 10 made it. Well, no, like that's not good enough. Right. And we can't keep doing the same thing. Right. We got to think about innovation. We got to do things differently, and things that aren't working, we have to edit and adjust. Um, Right. And like I said, there's a lot of people that are impacted, a lot of people, right? So 23.5, 24 million are in substance use disorder recovery. We know got a lot of people in recovery, also underreported. 7.7 million have co-occurring mental health and substance use disorders, right? So many people are impacted, yet often, right? It's like you don't want any, it's like this big secret. And the more normalized in the reduction of stigma, the more that we can talk about it. I've really been called to the space and called to the work because I just want, selfishly, I want my kids to grow up in a community that these are normal conversations that they can have, that they understand that mental health and or substance use disorders are not something to be ashamed of, but something to embrace and accept and be treated just like anything else. And so we need to really do that. And that's because we've spent so much time making the community that I live in a recovery friendly place, a place that people want to come and recover. And when I'm talking about recovery, this is always a big thing that we need to recognize is when we talk about recovery, what does that really mean? Because when I started this, I said my name is Stephanie and I'm a person in long-term recovery, and I gave you and said I don't do drugs, I haven't drank alcohol, haven't engaged in eating disorder behavior, so I'm in recovery from substance use disorders and mental health conditions, right? And I gave you amount of time, 16 years. But when we really talk about recovery in a general sense, we're going to talk about SAMHSA's definition, um, which is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Right? I don't see anything about drugs, alcohol, a time frame, abstinent base. Right? This is recovery. And what's key about this is it's a process of change, self-directed, and it's individuals strive to reach their full potential, right? That's the key. And if we had a room full of 100 people and said, how do you define recovery? Everybody would define it differently. So we have to come to a common ground, right? And this is where we start from, of what recovery looks like. And oftentimes people think recovery is just about the management of symptoms, and that is health. That is one dimension of recovery, but recovery is made up of 4 dimensions. Yes, health, that's the management of symptoms. But we know you can't just go to treatment and manage your symptoms. And it usually just like, that's it. It doesn't work out because you also have to look at the other dimensions. So we have to look at home, right? We have to have a stable and safe place to live. Too often do we hear people, they go to treatment, they do amazing, and then they return to a home that is not safe, not stable, and has high risk activity around them. And we have this saying in our space that if you hang out if you hang out at the barber shop long enough, you're gonna get a haircut. So what happens is people come back, they can't get into a recovery house because so many houses are full. They're on a waiting list. They come back to an unstable home, high risk behavior. They have a return to use, and we're like, what happened? Wow, you're so weak. How did you do this again? Right? but we got to look at these dimensions. We have to be able to have safe and stable housing, right? We have to have community. We have to have community that creates relationships, social networks, support, friendship, love, and hope. And most people that are impacted by substance use disorders, they need community of others with lived experience. It's really important that we have people like us. I am a parent, and I have a friend who is not a parent. He has cats and he's really sweet and kind, but I do not ask him for parenting advice, right? Because he just doesn't, even though he loves kids, it's different when you have kids. Recovery is also the same, right? We need people with that have that lived experience to be able to connect to. And then everybody needs purpose, right? I have to have significance. I have to have meaningful activities. Too many times I hear people say they had to return to use because life is just the same thing every day, right? They didn't connect into purpose. So we have to understand these dimensions of recovery. And then we have to also understand the foundations of recovery, right? That recovery starts with hope. It's person driven. It's not systems driven. It's not money driven. It's person driven, which means that it looks different, right? It has many pathways. It's holistic. Recovery for me wasn't just about, for me, I work in abstinent based program, but it wasn't just about me stopping drugs and alcohol, right? I had to look at my whole life. I had to look at how I did relationships. I had to look at my career. I had to look about how I managed time and money, my coping skills, right? So it's this, you have to look at this whole person. Recovery has to involve peer support. That's that lived experience. Recovery is relational. Recovery is impacted by culture. We have to understand that different cultures look at, view, and recover differently. And we have to be aware of that. I can't work with people as a married white female in Medina County and think that everybody's had the same experience as I. Not true. I have had excessive privilege that I need to be aware of in when I'm doing this. I need to understand how my family dynamic and how my culture impacts the way I sought help and the way I viewed myself in recovery. Recovery must address trauma, right? It has to be built on strengths and responsibilities. I remember when a friend of mine called me and we become friends because he'd reached out for detox 15 times and this was the 16th time. I could have said to him, which in my mind I wanted to scream at him, like, just listen to us this time. Don't just do detox and then stay for treatment, right? But his wife had already, right, put him down. Probation had already put him down. His boss had already told him like how bad he was. So at that point, I just said, "What? You're the most committed person I've ever met, right? We got to build on strengths and responsibilities." And then recovery comes from respect, right? That's that disease model. That's that non-stigmatizing language, right? And when I talk about recovery, we have to understand that it's multiple pathways. It's made up of multiple pathways. So it's made up of clinical, non-clinical, and self-management. So clinical pathways of recovery are just recovery processes that are aided by the services of a healthcare provider, clinician, credentialed professional. These are generally inpatient, outpatient, pharmacology, psychiatry, IOP, PHP, aftercare, case management, right? All the CBT, DBT, motivational interviewing, a million therapeutic processes. Harm reduction can be done in a clinical and non-clinical setting. Peer support can be done in a clinical and non-clinical setting. 12 steps can be applied in a clinical and non-clinical setting. But this is like family therapy, right? This is what you're going to use insurance for. You're usually going to pay for these services. So that's clinical pathways. Some people, when they recover, it's all clinical pathways, right? For me, I went to inpatient, I did outpatient, I did PHP, I did IOP, I did aftercare, psychiatry. I'm still in psychiatry, I'm still in counseling, right? And then you have non-clinical. These are recovery processes that don't involve a trained clinician, but are community-based and utilize peer support. These are also called recovery support services. So when we talk about building recovery-friendly communities, we have to have clinical and non-clinical options, right? Some people, they access recovery through recovery support services. Some people don't do clinical at all. I've always been a mixture of clinical and non-clinical. I need my meetings, I need my pro-social activities, I do faith-based activities, and then I need my counselor and I need my psychiatrist, right? And those for me that works. And most people I run into along their recovery journey, they have this ebb and flow of what that looks like using clinical and non-clinical. But communities to be recovery friendly have to have these types of options. I can't have one place that tries to do everything, right? And I have to have different options. Recovery support services, these are like recovery housing, recovery community organization, peer-based recovery support and meetings, education-based recovery services like collegiate recovery programs or recovery high schools, employment-based recovery services, right? Faith-based. Faith-based doesn't mean Christian. Faith-based means any kind of religion, physical activity. They have CrossFit, yoga, running groups, and then harm reduction, right? So these are all non-clinical, community-based, right? They're usually in the heart of communities, and they involve some sort of lived or living experience, right? And all of this makes up a ROSC, which is a recovery-oriented system of care, right? And this is our goal, right? To create recovery-friendly communities. These are coordinated networks of community-based services and support, person-centered, right? Here we go. That's the same word, right? Builds on strength and resilience of individuals, families, and communities to achieve recovery and improved health, wellness, and quality of life for those with or at risk of alcohol and or drug problems, right? So this is saying we're not going to operate in a silo, right? We want this entire community to be recovery friendly. So if I end up in the ER, they understand the language of recovery. They understand substance use disorders. They understand how to connect me to a network. If I end up in front of a judge, he's using non-stigmatizing language. He understands in lieu of programming. He understands how substance use disorders impact the justice involved. He understands reentry, right? It means for National Recovery Month, if I go to my library, are there books on recovery that are front and center, just like they would be during Black History Month and Women's Month and Christmas time, right? So it means in schools, we're having these conversations with our youth. We have strong prevention programs, right? It means that we have ways to access inpatient and detox and outpatient. We have things for men and women. We have things for couples and kids and adolescents and youth programming, right? We have this all-encompassing system, right? That sounds like perfect, right? Right. But this is what we work towards. This is a recovery-oriented system of care, right? And the whole goal of that is to improve access, quality, and effectiveness. That means, right, when I want to find recovery, I can find recovery. Recovery housing or affordable housing doesn't need to be some like lottery ticket that I need to hit. It means that I don't need to have an expert team to navigate the system, right? It's easy. I can kind of just show up somewhere, right? And a ROSC really starts with that person in the middle, right? And then we build around it. So you can see the recovery services, then you see like education, business, religion, right? Local, and then you see the state and federal around. So it's this whole system that becomes more recovery friendly. The big one for me is when they talk about recovery in my newspaper, are they still using stigmatizing language, right? Is that right? If I bring in a new recovery house, do we have not in my backyard, right? Like, are there employers and housing providers that are going to allow access to people that might not pass a typical background check, right? So the values of a ROSC, person-centered, right? Self-directed, strength-directed, and you have to have participation in the community. This cannot operate in a silo. This is about relationships, right? And at the core, we need to have recovery-oriented strategies as part of everything. Everybody has to understand, accept a common, similar definition of recovery, understand the language. They don't have to be experts, but they have to know where the resources are, right? They have to offer equal opportunity for holistic wellness. That means we have to have multiple pathways and we have to have this whole thing. If you have a community that has the greatest recovery housing, but you have no providers that provide trauma therapy, or you have no psych providers, you're going to have a problem, right? That the best housing in the world isn't going to overcome the gap over here. So it has to have equal opportunity. We have to embrace cultural diversity. We have to understand that although our community may be saturated with one demographic, that does not equally represent everyone, and that we need to build bridges into our underserved and marginalized communities. We need to acknowledge the role that spirituality can play in the recovery process, right? Oftentimes, often, not always, higher power or spirituality is part of somebody's recovery journey. If you go to a doctor or a medical facility that ignores that, it's going to be hard to connect with people in recovery. It doesn't mean that you have to like provide that or embrace that. You just have to acknowledge that there's a role there. We have to have data informed decisions. Oftentimes, grassroots nonprofits, they don't get enough funding to even collect data. And so we're missing kind of this magic equation of like, what is the recipe for recovery in our community, right? So we need data, right? We need research. We need to use language that is not stigmatizing. And we can't just have non-stigmatizing language in our recovery houses or our recovery centers. I'm talking about in our justice involved systems. What about at your child welfare system, right? Within child welfare, like stigmatizing language is super high, right? The judges, job and family services, the caseworkers, lawyers, probation officers, parole officers, our schools, right? Are we teaching young kids with non-stigmatizing language? Last time I looked at PowerPoints for middle schools, we weren't. We were using a ton of stigmatizing language. Can you imagine how those kids feel if their parent, right, or if them are having these struggles and all this like stereotyping and stigmatizing language is coming at them? We do need to recognize the special need to address children's recovery and adolescent services. We cannot just take what works for adults and pretend that's going to work for kids, right? They are unique, amazing creatures, and they have specialized needs. And what works for adults doesn't always work for kids. And just because we figure out something that works for an adult, it does not mean that's going to apply to an adolescent. And here's the big one is that we need to have collaboration, right? Not competition, collaboration. We have to work together across agencies and service systems. Right now, too often in our systems, we operate in silos. And you're like, this is mine, and no, like this community is ours and we all have to work together. And a long time ago, I didn't think this was possible. I grew up in Medina County. I grew up in Medina. And 16 years ago, I was in active addiction. And I went to treatment after some failed attempts. And I returned. I moved back in with my parents in Medina. And at the time, Medina was not a recovery friendly community in any sense. No, you didn't even talk about the word addiction. We have this beautiful community. It's got this square that is like a Norman Rockwell postcard, right? And I just grew up under this assumption that nobody here had any of these issues or, with related to mental health and or addiction. And so like I couldn't, talk about that. But when I came home, I started to talk about it anyway and really decided that we lacked in resources, that this wasn't a recovery friendly place, and that somebody would come help us with that. And then I realized that we are the somebody, me being a person in recovery. And so decided that I wanted to create a community that no longer feared addiction, but embraced recovery, right? And that's a question to ask currently, like, is my community recovery friendly? It's my favorite quote in the world. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it really, truly is the only thing that ever has. And so in 2018, a group of thoughtful, committed citizens, I got that group together and said, hey, I think we want more in the recovery community. And a group agreed. And so we had no experience. We had no idea what we were doing. And that was probably a gift because we didn't know the hard work that was ahead. But we started an independent nonprofit. We learned about recovery community organizations, which are nonprofits run by people in recovery. Like the majority of my board is in recovery. And we really wanted to hold the value of that lived experience. So we started in 2018. A group of us got together every week. formed a nonprofit, got some funding, got a building. Our Adam board was like, we're going to support this. And we opened our first center in 2019 in Medina. And we were going to focus on the three things that recovery community organizations focus on, which is peer-based recovery support, education and outreach, and advocacy. And initially, when we started this, we had a lot of not in my backyard. People, they misunderstood. They kind of challenged us. But we did it anyway because we knew that we needed it. And so Hope Recovery Community Medina was built and formed and opened. This is some pictures of what it looks like. If you're ever in Medina, come see us. I show these pictures because I think it's important to see how nice, how high standard, how modern, how clean. We wanted to show recovery is not some grungy criminal secondhand like corner of a basement. I mean, I've been in plenty of basements. It's fine, but we were going to raise the bar here. And so what I didn't realize, but when we made that decision at Hope Recovery Community, that changed the recovery landscape in Medina because you could no longer bring anything less than this into our community, which meant that all the behavioral health offices have improved. All the recovery housing like provider have improved, right? Because like we've set the bar and there was like this ripple effect. I opened a women's house like 5 years ago and they were like, we want it to look just like Hope Recovery Community. And I was like, yes, right? Because the first person that walked into Hope said to me, this is too nice for people in recovery. And I said, that is a problem, right? This is what recovery looks like. Recovery is nice. It's fresh. It's clean. It's modern. And the community takes care of it because the community, people will take care of what they build, right? Think about that. I'll take care of what I build. So we asked the community, they helped us put together furniture. What meetings do you want? What hours do you want? How can we, it's a participatory process. So we're always getting feedback from the community and they take care of what they build. At Hope, we believe that recovery equals willingness plus opportunity. Right? So when a person becomes willing, we just want to create opportunity. We also believe that seeking help should not be harmful and we're low barrier access to support. It should not be difficult. So we're open 365 days a year, about 100 hours a week. We run a 24/7 phone line. We have transportation, right? And we believe that lived experience is engaged at every step of the continuum of recovery. So when a person becomes willing, the best thing to meet them is another person that at some point in their life had become willing. So peer support. A few years later, we opened up a second location. We run some faith-based programming out of that in Brunswick. Then a third location, more faith-based programming out of Wadsworth. Then we put on a 3,000 square foot addition. So we have a massive meeting space. We have a rec room, which has ping pong, foosball, video games. Again, in our community, there's nowhere to do those things. It doesn't have high risk of behavior associated with it. Our meeting space now holds 80. On a Saturday night, we'll do a dinner and a meeting. That meeting can see anywhere between 30 and 100 people. Then we do a bonfire when it's nice outside. And then we do like late night. So this has become like the party house without the drugs and alcohol, right? And then we merged with Recovery Housing Entity last year. So we currently have 40 male recovery housing beds, level 2 and level 1. And right now we're renovating a condo and we will start the first level 1 women's recovery house in Medina County. So we're very excited about that. Lots of programming, pro social. We have a softball team, we fish, we roller skate, we have a cornhole league, ping pong tournaments, you name it, multiple pathways, all different kinds of meetings, education and outreach. We have a motorcycle group, right? There's Lon. They work on motorcycles every week, right? It's all just vehicles for connection, making our community recovery friendly. And then we noticed in our community that there lacked family support for loved ones. So we helped create it and helped promote what already existed. So we do family peer support. Then we noticed there were lack of life skills. And so we started the Recovery Life Institute for Excellence, which is a school. And we use partners to do this because partners are what build a recovery-oriented system of care. Then we noticed that our businesses weren't recovery friendly. So we found Recovery Friendly Workplace Initiative in New Hampshire and Nevada and replicated their model here in Medina County. So now we're training businesses how to retain and support people in recovery, how to have recovery friendly options in the workplace, and how to acknowledge and be aware of how substance use disorders impact people and families. We do an overdose event. This event's brought out thousands of people, right? And just really continuing to include the community. We did it outside at our center this year, and then our Ride for Recovery, 250 motorcycle bikers, right? So this is just building a recovery friendly community. We take motorcycles and people in recovery, the two of the most stigmatized things, and we put them together, and then we have bounce houses and foam parties and bands. And so we make it this like youth friendly event, family friendly event. And we get a massive turnout for it, and raise money for the organization. Right. Then we also do basic needs because we solve those we're missing in our community. Our 24/7 linkage team, they'll put 700 people in inpatient, outpatient, right? Detox. They just help people navigate that system, right? A safe place to call using peers. Um, Right, we employ about 30 people. We average on average 70 people a day. We have transportation because we know that to be recovery friendly, we have to help people overcome barriers. Um, we also have, you can see our collaborations. This is how you make your community recovery friendly. You make lots of friends. And so these are all of our collaborations, right? So all over the place, all of these groups are working with us and we're working with them. And we do language training with them. We do advocacy with them, right? We partner on events. They come into our center. We go to their centers. We do a ton of education and outreach. So we're teaching people. I don't know, like 10,000 people have taken our language training, non-stigmatizing language training. I've done it at libraries. I've done it at the hospital. I've done it in our schools, right? And so everybody's learning these recovery-oriented strategies. And then we do a lot of advocacy. And then 2 years ago, we had the idea to start a farm. We wanted to do innovation and recovery friendly communities. I think breed innovation, because recovery is the most innovative thing. You take two things that didn't work before and you make them work. That's innovation. Um, so you can see these partnerships, like, again, it's all about collaboration. So we have a 17-acre farm with a level 2 recovery house. This is the house. Again, nice. Built a garden. The first year, this garden put 1,000 pounds of produce into the community. Right, we donated that. So we have people in recovery combating local food insecurities, right? You talk about making your community recovery friendly. This is how you do it. You become part of your community. Right. We had our first honey processing this past year. So we have Hope Honey. Our residents are learning beekeeping. Then we have chickens. So they built our coop and we have like 30 chickens, right? Lots of eggs. And then I was like, we'll have 2 goats. Okay, 2 turned into like 12. It's fine. Goat math is like a real thing. They even delivered last year, our recovery housing residents delivered 2 babies. So here they are. And then we had a donor who donated a miniature pony. His name's Sunny. And Sunny's actually started to go into community and work with our youth events. Sunny needed a friend. So another donor brought us Otis. And so they at our farm and our residents say they provide non-judgmental purpose, right? It's just a different way at recovery. We expanded our garden. Last year, 4,000 pounds of produce went into our community to combat local food insecurities, including a free produce pantry at our recovery center, which was amazing, huge hit. And then the hospital, right? We want that hospital to be recovery friendly. They reached out and said, "Hey, can you put a free produce pantry at the ER?" I was like, "Yes, it's Cleveland Clinic." So last year we had a produce pantry at the main entrance of the Cleveland Clinic, to the ER. That produce pantry would empty out in 4 hours every time we filled it, and had this sign about that this produce was a result of empowering and supporting people impacted by addiction. Then we said, okay, we need to help serve youth. So we built a children's garden, which the children's garden led to a grant from OMAS to do youth services, right? Which now led to a whole new group of partners that were serving in our community with youth services. So Recovery-friendly communities are huge. And you can see in our own community this like ripple effect of what's happened of building a recovery-friendly community. And they have massive economic impact, right? So every dollar spent on substance use disorder treatment has a 400 return investment on healthcare savings, a 700 return on investment in criminal justice costs. Recovery support services are crucial, right? We need to fund them because they're a critical component, right? We're very solution based and they work. We know they work. Reduce relapses, enhance quality of life. We know recovery housing works. We know peer support works. There's research to back this up. Um, right? We're reducing homelessness. We're enhancing personal well being. We're engaging people in care. And we're supporting recovery, right? Long term recovery. Right. This is crucial because recovery support services are the bookends of the recovery process, right? We need the return on investment. We need to protect the treatment investment. So when somebody goes to treatment, we need to protect that investment. And we know people that are 5 years in recovery, research shows us that they are more than like 85% to go be in lifelong recovery, right? So oftentimes though, our services to support them are 3, 6, 9 months. Wait, but you got to help me get to 5 years, right? So give me a community that's recovery friendly. Right. An investment in individuals creates stronger individuals, yes, but stronger families and stronger communities. And that recovery oriented system of care, it elevates everyone, right? And it creates bigger workforces, people that are pumping into economies. And we just know that they work. So, what do you do? Like, what's next, right? To really take the steps to recovery friendly community, you have to do some sort of assessment, needs assessment, community assessment. They have all these different terms for it. But really, you got to kind of get organized, do this assessment, get a group together. I've worked with plenty of groups that are in this process to put together plans and implementation. But you got to get the recovery community involved. So I'm going to stop sharing so I can see the chat, but this is my information. So you can feel free to email me. You can feel free to call me. You can stalk me on Facebook. It's under Stephanie Robinson or Hope Recovery Community. We try to do lots of pictures of the farm. So you can take that down. I don't know if there's any question. Oh, wait, I see a question.
There was a question if this recording would be available, and I am going to send that out in the follow-up email, as well as we always link it to on the front page of our website. So if anyone would like to see that. And then there was someone else that would like to connect with you. She wanted to share some information and get some information from you. So I
Okay.
make sure that that happened. Does anyone else have? This was just amazing information. I didn't even know all that you guys did. I
Thank
loved your
you.
slides. You could see it all and just your spaces. That's so neat because I feel like so many times you hear about programs, but when you actually see them or you tour them, it's so different. And that was really
Yeah.
great to be able to see that on the slides. I was taking my own personal tour. I love that.
Yeah, and if anybody wants to come tour the farm or the recovery center, they can feel free to shoot me an email and we coordinate tours and things like that.
Great. Yeah. So if anyone has any other questions, you can throw it in the chat. If not, I know that Stephanie was kind enough to put her contact information up there, or if you email us at info@relink.org, we'll be happy to connect with her and pass that information on so that we can make sure that you get properly connected. I saw some of the people that had logged on today that are some of our friends through Relink that work in so many amazing ways in this recovery space. So I was excited to see them on. And thank you so much today for your time, Stephanie. We really
Thank you.
appreciate it. This
Thank
was
you.
excellent information and excellent presentation.
Thank you so much.
Have a great day.
Thanks. Bye-bye.